Guys ready?
Yes.
Good morning, everyone. This is October 23rd, 2023, the Mojave County Board of Health. I'll call this meeting to order. And can we get a roll call of the members, please?
Yes, good morning. Gene Bishop,
I am here.
Hunter Adams,
I'm here.
Terry Coyle,
Present.
Byron Stewart, Robert Leitz,
Here.
Auntie Manjo,
I am here.
Cal Sheehy, Sandra Thomas, Dr. Datwin. I'm here. Chad Kingsley present, and legal is present, Tingwei. And showing as members present, 1, 2, 3, 6 members present, we do have quorum.
Okay, thank you. If you'd all join me with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, so we have a call to the public this morning. Is there anyone in the audience that would like to address the board? See none, I'll close the call to the public and we'll go right into presentations this morning.
And for our first presentation, we have a presentation by Scott Wright, our Mojave County Department of Public Health Emergency Preparedness Coordinator. And this will be in regarding the Bullhead City School District tuberculosis exposure response.
Good morning, everybody. Let's see here.
Scott, is your microphone on there? Oh, it is. Okay,
hear me?
thank you.
All right, now I need to get to the,
Oh, Scott, it's also a touch screen if you want to just touch it.
I have it up, but it's not up there, so.
There you go.
Oh, there it is. Good morning, everybody. My name is Scott Wright. I am with the Public Health Emergency Preparedness Program with the Mojave County Department of Public Health. And as you are well aware of, we had a TB exposure in Bullhead City a couple of months ago. And I just want to kind of go over our after action report that we've in the process of completing right now. It's basically in the review stages. Okay, just a background on it. Starting on August 2nd of this year, and nursing division was made aware of approximately 600 plus TB exposures in the Bullhead City School District, Diamondback Elementary School. At that point, as a group, we responded, our emergency response team, which is made up of staff from our department, and we basically activated our plans. We made notifications to everybody that we needed to notify, from the state to the Board of Health, emergency management, things of that nature. And then we initiated, first of all, was a public notification education campaign. We initiated that, and we went through social media, web pages. We opened up our warm line, which is a telephone they were able to call and ask questions, things of that nature. We also opened up a Ask a Nurse email where they could send an email out and a nurse would be able to respond to them within a 24 to 72 hour time period. As well as we also had person-to-person contact with anyone that had any questions, as well as contacting the hospitals and medical providers in the area. On August 11th, we initiated a TB clinic at the Diamondback Elementary School. We were expecting 600 plus individuals to show up. However, there was only 127 folks that arrived. And out of those, there were several cases that were reactions to the test. However, there was no active cases out of that group. From there, we continued to reach out to individuals by contacting them by email, by telephone, encouraging them to get the test so that we could maybe prevent any further spread of the disease within the community. We offered them to come to the nurses' office there at the public health office in Bullhead City, as well as we offered them, if they didn't want to go there, that they go for pay for services within the community. On August 23rd of this year, we actually demobilized our emergency response team. We figured at that point, we reached out to everybody that was going to take the tests, and there's really no further action to take. And anything that would occur, we can monitor that by our nursing division within the community. If we felt the need to activate the emergency response team, once again, we could have done that, but at this point, they were able to continue on with their efforts at the local level there in Bullhead City. As a result of that incident, what we do is we get together and we say, hey, what did we do good? What did we do bad? What can we improve on? And the first thing we always kind of look at is the positive things that we did. And those are our strengths. And the first thing we all kind of agreed on was the immediacy of the nursing response. Nursing took immediate action, and they were right on the ball with that. Specifically, the nursing division in Bullhead City, and then through the leadership from the administration folks here in our nursing division here. There was a multi-agency collaboration. We contacted ADHS, Poison Control, our internal IT department, Bullhead City School District, Bullhead City itself, and of course, all of public health. The ADHS put us in contact with Poison Control. Why was that important? Well, our worm line was activated during business hours. We didn't have 24-hour access. Between ADHS and Poison Control, we were able to work to where Poison Control would monitor the phones after we closed our business and on weekends. So there was a great collaboration effort between that. Our IT department within the first day had our website set up to where we could, people could go to our website and get any information that they wanted to on our website. They also helped set up our warm line and our message line for people to gain information. Okay. The effective utilization of communications outlets. So we used everything that was at our disposal: online, social media, website development, email, phones, as well as in-person communications, pretty much what we just discussed. As well as one of the big strengths that we had was the professionalism and the experienced veteran staff who effectively guided the response. This was my first time dealing with something like that, so it was really nice to have a nursing division as well as an epidemiological division that was able to help guide our response to it. So, you know, people talk about turnover and things of that nature. One of the nice gifts that we had within the public health department was those key players within our department that was able to help guide this response. So I think that they deserve kudos just for their knowledge that they brought to the table. As well as adaptivity and teamwork were part of the response. So we were able to adapt to this situation. And the teamwork that was brought to bear was key to our response. So those were our strengths. And now the areas of improvement. One of the things that we kind of decided was a better procedure for media release reviews and unified messaging. One of the things that you want to do when you have multiple agencies responding is you want to make sure that your message is the same. So what we're looking at right now is going into our CERT plan, which is our a plan for communications with the public, is maybe tighten that up a little bit. We did a really good job on that, but there was some disconnect a little bit, especially on our first media release that did not quite line up with the Bullhead City School District's media release. It was a very minor things, but when people are kind of looking at the situation and they see these differences, the first thing they look at is not the similarities, but the differences on it. It was negligible, but it was important. So we decided it was really key to make sure that we put our JIC together, Joint Information Center together, to where in the future, we make sure everybody's on the same page when we put out any type of media release. So that's one of the things we're going to tighten up a little bit. And that kind of leads into the unity of messaging was not clearly established. So we want to consider a joint information system or a JIC, which is a center. During our meetings, sometimes they kind of went off topic. So one of the things that I need to do better when we do these meetings is maybe more clearly define what those meetings are about. We put it together agenda, but once again, I'm gonna need to tighten those agendas up and maybe keep people a little bit more focused on that. That's not to curtail discussion, because I think discussion is very important in all of these meetings, because that's where you bring in everybody's point of view and their thoughts. We just need to make sure we don't get off topic to discuss other things that may not be relevant to that specific things. Key thing to that, will shorten the meetings and get things in motion much quicker. Lack of adequate personal information for the online list. So part of one of our systems is to track these things, and this kind of goes back in the epidemiological side of the equation, but tracking people is maybe making sure that the information we get is what we need for the system. So we just need to look at one of our plans to make sure that that information is clearly stated in that plan. It wasn't a big problem, but it was a problem. It just maybe delayed, maybe getting some input into the computer system, into MedSys system, that would we can maybe curtail that issue in the future. So we want to look at that plan as well. Lack of confidentiality awareness. Whenever we're dealing with a topic that deals with a person's medical history, HIPAA is probably one of the biggest terms that is thrown around. What we want to do is make sure that we comply with all of those rules, and we just want to make sure that everybody is aware of those rules. So we're going to be looking at our procedures on how we make those notifications to the groups that we're dealing with. And then finally, the communication gaps with healthcare providers. We currently have a system, we call it a fax blast. So we send all this information out through a fax machine, which is pretty archaic in today's type situation. So we're looking at different ways of maybe fixing that to make it more modern. So one of those potentials are Code Red that the county has, is maybe hook up a system to where we can notify people through Code Red. We're looking in that, and also the state has an option that is the AZ-HAN system. We're looking at that as well to be a potential way to close that gap, to make it a little bit easier to communicate with medical community outside of public health. So what are our recommendations? Well, like I said earlier, we're going to review our CERC plan. And that's going to be just make sure that the GIS and the JIC and the media review procedures are what we need to have. So we're going to look at that plan. During our meetings, we're going to make better goals and objectives. They're going to be stated up front for what those meetings are. So we're going to have that right off the bat. The third thing is that we're going to review the outbreak response plan for the information needed. And that goes back to that epidemiological information that we talked about. We want to make sure that that information is there so that we can get that information sooner and put it into the system. As well as we're going to review the HIPAA and the confidentiality training, make sure everybody is aware of that. And we're going to explore communication gap solutions. That was the Code Red and the AZ-HAN. And then one final thing is we're going to review the packaged in our pods, kits for needed supplies. We just want to make sure that we have everything that's adequate for those situations. Our pods is points of distribution. So we have kits. We just want to make sure all the stuff that is in those kits is what we will need for future pods or clinics. So conclusion, we feel overall the response was a success. And the major factors on that were the knowledgeable, tested, experienced, and veteran staff, specifically nursing, our logistics folks, and our epidemiological departments. Without their leadership, I don't think it would have been run as smoothly as it was. Our communication and the use of our resources was well done. I think we used everything that was, we had available that we could push information out. And then the teamwork and collaboration efforts and the support from the Bullhead City School District, ADHS, Poison Control, Mojave County Board of Health, specifically Dr. Nguyen. Without his participation in the program, I don't think it would have been nearly as successful. And once again, we talk about experience there. He brought a huge amount of information and guidance in our response. City of Bullhead and the Mojave County Board of Supervisors. The reason I mentioned the County Board of Supervisors is our funds were kind of being depleted, and we went to the board, or actually we didn't. Dr. Kingsley went to the board and requested additional funds, and the board provided those funds so we could meet the needs of our response. Mojave County Department of Public Health itself, it was an all hands on deck response. Everybody within the department helped us in one way or another, whether it was a direct response or whether or not they basically took care of the day-to-day operations while the rest of us were out at the clinics and doing the response at other levels. So kudos to all the staff that was a part of our department. I was proud to be part of the department during that time. And that pretty much talks about the last 2 points on there. So first of all, I'd like to thank you. Finally, I'd like to thank you and your support for our response. So thank you. If there's any questions.
Thank you, Scott. It sounds like this response really was a success, and kudos to you and all the staff and to Dr. I know there were a lot of parents that were frightened at first, and I think that your professional response to this brought a lot of comfort to the parents, and kudos to everyone for keeping this under control. And I know it was a good response because I got no phone calls to my office saying,
That's always good to hear.
what's going on? So the information was put out there, people were understanding, and I didn't intercede, and I don't think any of the other board of supervisors were contacted negatively. So thank you. Does any of the board members have any questions or comments?
I have a comment. I thought, as an old nurse, been a nurse for 50 years, you guys did an awesome job. I watched from the very beginning of the news of the outbreak what happened, and I talked with the school systems and stuff. You guys were phenomenal. I can't tell you what a great team you have out there. So thank you. Just thank you.
I have a question.
I would say as textbook as it could go. It went as textbook, as excellent as we could moving forward, and we learned some stuff from it, but it did go well, and the team did an amazing job. Recognized too, District 4 as well as the city of Bullhead also provided lunch for us during that day and stuff, so just want to commend their, providing us, supporting us during that time, and everything that went well, and just the staff, they did a phenomenal job, so, yep, thank you.
I have a question. This is District 2, Terry Coyle.
Go ahead, Quan.
Mr. Wright,
Yes, sir.
of these 127 tested, how many of those was actually faculty and staff versus students?
So we do have, so we did prepare for this. So Lynn Valentine, nursing manager, she's here. She can give an update on the numbers and also those specific questions.
So as was mentioned in Scott's presentation, we did have some reactive skin tests when we did do the mass testing. It was less than 15 individuals, and due to the low numbers, we prefer not to break out who were adults, who were children, but I can tell you that less than 15 individuals came back positive. And at this point, we really can't determine if those positive results were a direct tie to the active TB case that we were following up on, or if these individuals had been exposed previously, earlier in their lifetime, to another active TB case elsewhere.
Thank you very much.
You're welcome.
Thank you, Lynn. Anyone else?
I just have a quick comment. I appreciate the team, we share, the important thing about this, we learn is this, we help us prepare for our future, you know. And I think we can learn from this and grow from this process. Just want to update the board. We also sent a letter out to the provider in the community, and you know, during the process, I feel that is important because the provider in the community and the school work very well with us. I think the successful the process here is that the participation and you know, open communication. I think it's great to be able to reach out to the community provider. That's also our team members. So I just want to, you know, add that.
Okay, thank you. Thank you, Scott. Melissa, did you have anything else to add?
Lynn.
Or Lynn, I'm sorry. You're Melissa today.
No, I just wanted to say that the work continues as far as we still have case management of the active TB case. We also have case management going on of those individuals who did have the reactive skin tests and have opted to move forward with the antibiotic therapy that latent TB cases are offered. So there's case management still going on. We haven't had too many other individuals who've come forward who didn't get the testing at the time it was offered. We haven't had too many reach out and say, hey, I want to do it now, which is still possible. We still have that option available, but it still goes on. We have some, once again, as mentioned by Scott, we have some wonderful individuals and staff, very experienced staff who are handling it. And so far, everything is going well.
Okay.
You know, I would add to it too, just looking at this, you know, TB is almost kind of perhaps forgotten about. You know, it's in our old Westerns, and they don't make too many old Westerns anymore as consumption. But just seeing in the news, you know, over the last year, and we just in California just had their first non-travel malaria case identified over the past 2 weeks. So we're seeing things that we as a community, as a nation, haven't really experienced that we did historically, but now, because trains, planes, and automobiles, you know, in the most part, but we'll see that. So now we have a neighbor next door, so, you know, mosquito control besides just Zika, but also now, you know, dengue as well, and these things. So that's something that, you know, why public health is here, to help monitor those. And we are monitoring them. We do have not a robust, but we have a good mosquito control, testing and system in place, as you guys have we've previously spoken about. But also this is really what our epidemiology and our nurses are here for really to help combat those things that perhaps we're forgetting a little bit as communities as well as a nation. So,
well, I think with the modern mindset of anti-vaccine, I think a lot of us forget about some of these diseases that were such a big part of our history and really scary times that we've forgotten about because they don't exist anymore. So I am seeing some of these old time diseases that we forget about are sometimes coming back, unfortunately. So thank you very much. So at this time, I think we'll go on to the next presentation. And now Melissa can take the floor. She is our Assistant Health Director and will be giving us a suicide mortality review.
And Chairperson Bishop, just to recognize that board member, Mayor Sheehy, is online.
Okay. Good morning, Cal.
Good morning.
Okay, good morning, everyone. I'm going to go over our suicide mortality review findings for the year of 2021, and I'll discuss why we are at 2021 when we're actually in calendar year 2023. So the origin of Arizona's suicide mortality program came out of SB 1523, and it's also known as Jake's Law, which was passed in 2020. Jake Machowski was a 15-year-old with a history of suicidal ideation who was unable to get the help that he needed due to health insurance coverage. SB 1523 established the Suicide Mortality Review Team under ARS 36199, granting the authority to local health departments and the state level also to investigate suicides for information on future prevention efforts. The goals of the program are to identify opportunities to prevent future suicides by identifying barriers and service system issues experienced, identify significant risk factors and trends, improves delivery of services to individuals, families, and the community, to analyze the adequacy of laws, trainings, and services and possible implementation strategies to improve upon them, inform local and statewide prevention strategies, and to educate the public on the incidences and opportunities for prevention. So before SB 1523 was passed, in 2019, the suicide rate was 18.9 of 100,000 persons. It was the 8th leading cause of death in Arizona and 36 above the national rate. In 2021, which is the year that we're looking at cases, it was the 10th leading cause of death in Arizona. But you'll notice that it was 1,479 deaths and at a rate of 20.3 per 100,000 persons and 44.5% above the national rate. So even though it was the 10th leading cause of death, we did see an increase in cases in that year. The teams have access to a list of information, and I've listed it here on the slide. The common items we receive are the ones that are highlighted. So we're able to get the death certificates very easily, medical examiner reports, the hospital, nursing, and/or medical records, and law enforcement reports. The other items listed there, we either don't receive ever, or every once in a while we'll be able to get one of those records. As for the program's procedures, we initially received the list of cases from Arizona Department of Health Services. They're the ones that assign cases based on the decedent's physical address, not the location of death. So it's whatever is on their driver's license or where they receive their mail. That's considered their physical address. All information, including requests and documents obtained, and any of the discussion that occurs within these meetings is confidential. None of the information obtained is subject to legal proceedings or open meeting laws. All participants are required to sign a confidentiality form, and any violation of the confidentiality requirements is a Class 2 misdemeanor. The team does not review cases for anyone under the age of 18, pregnant or postpartum women, or cases that are undetermined and/or accidental. Anybody under the age of 18 that goes to our child fatality review program. Any pregnant or postpartum women goes to the maternal fatality review board at the state level. We do review overdose deaths, and most of those are reviewed then twice, because if it involves any type of overdose, it goes to the overdose fatality review team and to the suicide mortality review team. And we both provide feedback. They do it on the side of how could this be prevented, either medication-wise or access to those substances, and we look at it as what could have occurred to prevent the suicide itself. The meetings occur on a frequency necessary to review all the cases. So for 2021, we were meeting once a quarter. No names are provided during the reviews. only a summary of events, and any specific details that can help the team determine what was needed for that particular case. Then the team discusses any services the individual received, risk and protective factors, including ACEs, or adverse childhood experiences, recommendations for system improvements, and prevention strategies. The next couple of slides are the categories for prevention. This one is the healthcare, so for anyone who had been seen by a provider or in the emergency department. Then we have a category for criminal justice for those who were justice involved. Crisis response for those who were in crisis at the time of the event. So this could have been either a crisis team, a mental health crisis team responding, or law enforcement. And then our last category, which is the community. So opportunities for the public, family, friends, and community resources. This is our demographics for the year 2021. And again, we just finished the review of these cases in June of 2023. The team prioritizes veteran and law enforcement personnel, retired or otherwise. And then we do the remaining cases according to age. So we just start at the youngest and work our way up. The pie chart here shows that veteran status is almost 25% of our cases. And then if you look down below at the sex of the individual, about over 80% are male. The age range in which many of our cases fell are from 55 years of age to 74 years of age. This pie chart shows the causes of death. You'll see that 69% are firearm related, 21% is hanging or strangulation, 4% is poisoning by drugs, which would include overdose deaths, 2% poisoning by gases or vapors, and then 4% is other means. And that could include a vehicular incident, so something involving a vehicle. For our 2021 activity, we had a total for our county 78 suicide-related deaths. 33 of those cases were assigned to us. So out of the 78, only 33 fell into the category for us to review them. All of our cases were reviewed. The top recommendations included healthcare, increased training for healthcare staff to better screen and treat depression, especially prior to release from the hospital. Many of our cases were in the emergency department and returned home, were released from the emergency department, returned home, and had a successful attempt within 24 hours. Our criminal justice category, we had improved care coordination post-release, so that it involves having a warm handoff to alcohol or substance use disorder treatment, medical care, and or community-based mental health services. Again, many of our cases, they had been recently released or released within the last year from either prison or jail and had a successful attempt. And then community, increased gatekeeper training for community members to identify people who may be at risk of suicide and how to respond effectively. This item for our county, we have increased the opportunities for mental health first aid training. We do now have 3 trainers within our health department, and that is one of the ways that we're addressing this particular item. The next one is reduce access to lethal means by people who are at acute risk of suicide. That includes medications, firearms, and certain chemicals. That is more of a state level item. We can do messaging for, ensuring that medications are locked up and ensuring that firearms are locked up. But anything beyond that education and messaging, it really needs to come from the state level. And then our last item was decrease stigma and increase help-seeking behaviors. And again, a way that our health department is addressing this is through mental health first aid training. And then during the month of September, we pushed out the 988 number, the 1-844-534-HOPE, and individuals who are in need can text for HOPE. And both the 1-844 number and the for HOPE numbers, those are Arizona state-specific resources. The 988 is nationwide. So these next few slides, they're somewhat small, but it's the data detail for each of the items under each category and how many totals we had. There is an opportunity to provide feedback to the state regarding any other ways that prevention could have occurred. The common ones provided to the state for the 2021 cases include firearm safety for those who are diagnosed newly or otherwise with dementia or Alzheimer's. We do have a number of individuals who are either newly diagnosed or further along in their journey with dementia that had access to firearms. Quality of life, providing respite for family caregivers. This helps individuals who are in need of support, additional support from their families, to not feel like they are a burden on them and feel like they can continue on with whatever health situation that they are experiencing without creating a permanent solution to that. Locking up of potential objects for individuals with previous attempts, including knives. Decrease firearm access for those who were previously convicted of domestic violence. Some cases involved some form of domestic violence, and in the end, the individual takes their own life. We received the 2022 cases in July, and instead of 33 cases, we now have 107 cases to review. We are currently recruiting individuals to come and sit on our team with us. That includes any professionals, community members, and those serving high-risk populations to serve on the team with us. The next meeting is going to occur on November 29th in Kingman. And here's my contact information. If anybody is interested in serving on the team, we would be happy to have you. Please email me and let me know. Any questions?
Thank you, Melissa.
Gene? Yes, I noticed at the beginning of the presentation that pregnant women or women within the 12-month confine, that was exempted. And is that a special category, or why is that? Help me understand that.
It is a special category. Arizona Department of Health Services has a maternal mortality review program, and that's where those cases go, is to that group.
Okay, thank you.
Mm-hmm.
This is Hunter online. I had a quick question, and thank you so much for your efforts on this. I'm wondering, with the size of Mojave County, if there's any discussion on looking at like geographical pockets of suicide. I know trying to get local data up here in Colorado City, Colorado City and Kingman maybe have different, challenges when looking. And so I'm wondering if there's any geographical differences, or if that's been looked at all in this committee.
We have categorized the cases according to location. And to be honest, most of the cases are occurring outside of the city limits and within rural locations. We have had some that have occurred in your region, but to be honest, right now, the majority of cases that we are getting, they are in the lower level rural locations south of the Grand Canyon.
Thank you so much. Yeah, that would be just a great, just a great point, when looking at some of the demographics as you have it by age, gender, et cetera, kind of with Mojave County being so large. Just thought I'd throw that out there.
Similar to what Lynn stated earlier, we do have to be careful of identifying specific cases for certain areas because they can be easily identified due to if one location has one suicide, then the community members within that area could easily identify who that person is. So we would have to do it in a more generalized fashion where it was, I don't know, I'd have to look at the data to be able to split out the county so that way it wasn't easily identifiable for anyone.
That totally makes sense. Thank you.
Mm-hmm.
This is Terry Coyle from District 2. I have a question, Ms. Palmer.
Yes.
You had mentioned about the pregnancies not being part of that. Is that the same thing with the teenagers under 18?
So anyone under the age of 18 goes to our child fatality review program, and those are for children under the age of 18. That team reviews those cases and makes those recommendations.
Okay, thank you.
You're welcome.
I would just say, looking at this broad picture as how we're going to look at this for our community, for public health and moving forward, we are seeing an increase in suicides. Many communities are, and there's never one specific cause. We do see a decrease in religious observance, which influenced it, before this time. And so we're seeing a decrease in that. And what do we have, to replace it in a sense, to fill that gap that for those that perhaps, don't have those historical type of resources. And so it would, of course, go to a community and being able to engage the community and provide those points. So, as public health, we will continue to look for grants that we can increase community programs, outreach, mental health, behavioral health. It's a hot topic. Increase in substance abuse is also tied to, suicide. They kind of go hand in hand in the sense of somebody doesn't have the correct coping mechanisms. So sometimes it's either suicide or they go into substance abuse many times to do that. So getting to the root of the problem and really part of it. And it's generational too. So beginning where we can with youth and really addressing the problem and helping them so that they are aware. And it takes a community, but a long time to be able to put those in place. So addressing the issue where it's at and then planning ahead. And I would say that would be one of our focus at board, really to continue to see those trends and where can we lay the foundation so that we see the numbers go down in so many years in the future. So I would say that would be our focus and concern. So thank you.
How do you ascertain when a strategy is successful? Where do you get those numbers? That's I would say almost impossible, but how do you know if a strategy that you're using is successful?
The unfortunate thing with any public health effort is that you have to be invested in it for the long term. So a lot of things are not seen for 5 to 10 years. I mean, look at our tobacco cessation programs. We saw tobacco use rates that were still high for many years after those programs started. It just takes time for us to really make a difference.
So the answer is time.
Yes.
Yeah.
It's really, we are setting the foundation so a Board of Health and Public Health Department in 15 years can see, oh, hey, our numbers are down. So it's really setting that foundational work. And again, it's what public health is. You never get, thanked for that mosquito bite that doesn't happen, and stuff or whatever. Same thing here. The work we do now, we'll get no recognition for it or even the value of it until perhaps 10 to 15 years down the road. So, yeah.
Problem with statistics.
I think think the main thing is public awareness and knowing where a person can go to find the help that they need or their family member needs. So
Absolutely.
we're reaching out, we're doing the best we can, and hopefully it's making a difference. Okay. All right. Thank you very much for that presentation, and that concludes what we have this morning for presentation. So we'll go into the consent agenda, beginning with the approval of the minutes for the Board of Health meeting on July 24th, 2023. And in reviewing these minutes, I think I'm going to recommend that they be redone. They're very, very difficult to read and understand, and it appears like they were computer generated. So I don't know about the rest of the board, but I'd like to see a real person doing the minutes and maybe condensed a little bit more than this.
And so on that, it's just, in this process, we wanted to be sure we were in line with the law. And sometimes reading ARS and following certain points is a scavenger hunt. But we have met with the clerk of the Board of Supervisors. She will help us condense, and we can bring these minutes back for the next meeting.
All right. Do we need a motion for that to continue till the next meeting?
Tingwei?
Sorry. Yes, we do.
I'll
need a
do that
motion.
in the form of a motion then, that we continue approving the minutes until next meeting where they can be condensed and rewritten.
I second.
Okay, all those in favor, say aye.
Aye.
Any opposed? The motion does pass. Thank you. Next item on our agenda is the Public Health Director update.
Great, thank you. Overall, just a report that, and the department is functioning well. This is a very busy time for us at this time of year when weather improves. Many festivals, outside health fairs, and outreach occurs. So many of our staff are out in the field with the community. Nursing division is continuing with all their mandated purposes as well as services, as well as environmental health is actively doing their inspections, keeping up to date. We are short-staffed in a few places, but the staff is managing to maintain those numbers at adequate and appropriate levels for both nursing and environmental health. We did have a salmonellosis case that did not result in further, but we did investigate when coordinated with the Arizona Department of Health Services, investigated that and did not find further spread of that here within our community. But if anything from that is just to say that our surveillance program and our response is more than adequate, and we are correctly has the surveillance within our community to identify any of those possible exposures or cases and being able to follow up and make sure that they are resolved. On the 2 points I'd like to, for recognition, one is first, it's called the Fearless Program, which is public health, resiliency leader, and I what that E is, training. It's a training program. It was, we applied with 2 community organizations in Colorado City. There are 15 national programs that have been chosen. We were one of them. It'll be a year-long program. It was Cherish Families as well as board member Hunter Adams, for Creek Valley Clinic are participating, and with myself and Tara Stanek, we form a community collective, and us as a public health, we're supporting them. They receive $100,000 to make an intervention within the community, as well as receiving leadership to be able to address those issues within a community. But they'll be developing a project or intervention over the next year to apply to Colorado City to help improve public health there. So we're excited. It will be announced nationally this month or within the next week or so with a public release, as well. We'll be doing a public release here within the county, just recognizing the community collective and the efforts and the award that will be going on there. Equally want to recognize the Behavioral Health Training Institute for Health Officials, Melissa Palmer, our deputy here at our department, was awarded to participate in this program. She receives access to training as well as resources for behavioral health topics. So really cultivating mental health resiliency and supporting crisis leadership. It's through that process, then she'll be one of our leading, be able to provide more expertise in this area of behavioral health, which we see a great need of here in this community, and want to recognize her being awarded to be able to participate in that program and her efforts in that. So a lot of great work to being done there as well. Just an update on medical examiner. I always feel like I need to knock on wood, but everything going well, very silent. There are many challenges with forensic pathology in the United States right now. There's over 12,000 positions open and only about 6,000 filled, and only about 35 graduates a year out of the fellowships. Arizona does have some physician's assistants can actually fill in, and so we have to explore that. Salaries are very expensive for them right now, so, and dealing currently with the Board of Supervisors, the morgue has been taken off the capital project improvement process, and they will address that again in January, but there may be a delay or a suspension of the morgue facilities being constructed within Mojave County. And then we will just have to, we really have to proceed to the next point. But medical examiner services do continue, very functioning as right now as efficiently as possible with our funeral homes. We will have an upcoming, by Arizona law 11-600, the rotation list, and that is for a funeral home that they are put on the rotation for the month. They receive the phone calls to be able to come and retrieve a body for that, and it rotates each month between funeral homes. Historically, we're not really sure where it occurred, but that had previously been conducted in the fiduciary, but by ARS lots to be handled by the medical examiner. So we will need to amend contracts and update on that process and inform everybody, and that should be taking place by the first of the year. Hopefully it should go smoothly. Normal process there, and that just helps timely delivery both for our law enforcement, that when they call, they're expected to respond within a half an hour, so that they're not tied up for 2 to 3 hours out in the field, and be able to be more efficiently within our community. And then also within hospitals and hospices, just make sure that process is going well there. But overall, continuing, some services that have previously not been open for cold cases, as well as DNA, ability to test unidentified cases or John or Jane Does, has begun to open back up. So the medical examiner is working with the sheriff's office. Still some funding challenges and different there, but it is progressing. They did recently identify some cold cases we had here in the community, but things are going well there, I'd say that, as expected. Next, opioid settlement funds. So last Board of Supervisors, the first of our pilot program, we developed a request for proposal. We received 15 applicants within our community. It's been a learning process for us as well. This is, I would say, one of the first times we are actually giving out money as a county. So we're learning that process to be able to get the money out into the community. I'll follow up in January just with an update of kind of the QI process, but our official really starting process would begin in February, March. We offered $200,000 for the awardees. It was probably a little bit too high, but it was a good learning curve. But we did identify 5 different agencies that have been awarded by the Board of Supervisors for this one-time funding as this pilot program. They cover majority of the county for their services. From there, whatever, so we are going to look at having a lower amount of money perhaps, and being able to award more within our community to make sure that not only larger organization, but also those community organizations that are smaller and boots on the ground are supported. So really trying to see how effectively, and again, as I've said, this is building the airplane as we're flying it. But we are one of the first counties to do this. In one of the rural counties, we are the first. Maricopa and Pima did offer some, but being the larger organizations do have those resources to be able to do that. But we are ahead of the game, I would say, and being recognized for that. The state Attorney General does have $41 million and has $47 million. We'll receive another $41 million for the state to distribute. They had their first meeting on it. And apparently it was more of a popcorn meeting, sitting and watching than supervisor meetings across the state on the challenges. So there's a very large learning curve there, and only 4 counties were permitted to apply for the grant money for reach out programs. We were not one of them. So that is a state level issue, but definitely hopefully will progress more readily so that communities can access that, especially for capital project improvements. But that is an ongoing process that we're working with. All 15 public health directors are anxious to help influence to make sure the money goes to the right place as well from the state and as well, but don't have a lot of control on that yet. So overall, that's just a quick update. I'll take any questions.
Dr. Kingsley, how does an organization apply for this grant money? Is there a process that they would go to the health department to get an application?
Yeah. So with this, we went through our procurement department. They put out a request for proposal. They, just like any grant, so just like they fill out, there was 4 scoring criteria. And then from that, scorers are selected. They review each application. They are scored. And then from that score, the top, those that are identified as the top, that meet the qualifications, it starts down from the process of that, from them being awarded. And there is the option of the last 2, the 4th and the 5th that were awarded, they were awarded less money. They were each awarded, I believe, $100,000 instead of $200,000, but we're able to extend it out from there. So moving forward, the request for proposal process will begin in February, March. We'll go for either 4 to 6 weeks. We'll close, and then they will be reviewed and scored and then awarded in May or June so that they will have a fiscal year with that money from July to June every year. Again, this was our pilot program to really see how it functioned. It can function and will do well, and it's a good way to identify that helps to remove some of the challenging bias of bleeding hearts like myself that would really just like to give money to everybody and help them run. But there does need to be a process to it so that it's done correctly and that we have record of it. So, yeah.
Okay.
Dr. Kinsley, this is Terry.
February
What
and
is-
March, the process will begin again.
Yeah, so the process, the more official process will begin in March, and then member Coyle, you had a question?
Yes. What's the name of this grant?
Arizona One opioid settlement monies.
Thank you.
One Arizona settlement. Where this is unique, again, is just that, so this was a lawsuit. This is not funding from federal government, from state government. This was, which really began almost from the efforts of Supervisor Angus, really looking at the manufacturers and distributors of opioids and how they impacted communities, raised the alarm, began a lawsuit, which then became state and then multi-states, and there were 43 states that entered into this. So the money being awarded comes to the Attorney General, and then the Attorney General. So again, the Attorney General is not like a normal organization or agency that gives out money. So it's definitely a different process, but it's the one Arizona settlement. So.
Okay, any other questions? Seeing none, thank you, Dr. Kingsley. We'll go on now to the Mojave County Activity Report.
Yep, that will be me too. It's actually me and the managers. And so, and I did print it out for you. This is our inaugural activity report what I've seen and being able to provide you as well as transparency to the board, to you as the board, as well as the Board of Supervisors and our community at large. I'm going to pass these out. I am going to go to the podium just to pass through, and then we'll go through our managers. So the reason behind this is hearing is many times is what does the public health department do? How are they accountable? What are the activities? And many questions. And we want to be responsible to both taxpayers and our community, as well as Board of Supervisors for our activity and those things that we do, for our funding, when any type of funding or questions and those efforts. So in part of this, on the 15th of each month, so this is September's report. By October 15th, each of the divisions turn in their activity. And as well as, which I think is important too, is building that foundation. So moving forward as well, that we can also begin get to a 3-year, 5-year process. And that's really as a board member, as a board, so you can see, okay, well, I see numbers going down or I see them going up, and you can see trends and identify, and then as well, we can bring them forward and say, this is what we're seeing, and be able to do that. But also, this is just transparency as us as a department. So as we go through this as too, I'd just also like any of your recommendations on this as well. I would encourage either I can send it to the Board of Supervisors, or if you as the appointed for your districts would like to take this activity report to be able to go and take it to your district supervisor to discuss any needs or concerns or those identified. So first beginning would just be my activity report. So you'll see that it has September, and then 2022, and then 2023, and then you have fiscal year to date. Then you can also see where the numbers are at for the fiscal year up to this point, and fiscal year is July to June 30th. So just reporting my work hours for full transparency for both what I'm delivering and that I was hired for. Next, also location, where I am at and what I'm doing. I like to try to be present in all our communities. So from Kingman, which is our county seat, but making a point to be in Bullhead City, Lake Havasu City, Colorado City, as well as alternative work days, which can be conferences, Phoenix, and meeting with Arizona Department of Health Services and locations. And then also the days that I end up working on Saturdays and Sundays or Fridays, or in different days that I have already met my hours for the week and have worked over. And then there's always that phone call where I'm available 24/7. So they have those alternative days as well for working. And then just my essential functions, trying to identify, and I might tweak these here and there, but just rural communities visited or contacted. So the individuals that I've gotten to know, and continuing contact. Sometimes it's as simple as chloride. So like last month, an example, we reached out. They have a Chamber of Commerce, very active, but it's also where you can really get to know the community. We visited there, took the mobile unit out just to show them, but then from that, they had their Old Miners Day, I believe, last Saturday, and our mobile unit was there. We learned about that. They invited us to that. So it's really showing up. You know, I always kind of think of like your kid's soccer game. You might not want to watch it, but you got to show up. And so that's really is that we're present within our rural communities and being there and developing those relationships. And that's an emphasis of mine, as well as for many for our staff. So next is just my correlation with Arizona Department of Health Services as well as Arizona State. And when I first started, I always said Aloha, but it's ALHOA, and it's the Arizona Local Health Officers Association. And again, it's a non-lobbying, it's just the 15 public health directors get together and we discuss matters, and we meet at ADHS and we really coordinate, or we meet virtually and we coordinate with them. And it has, for the TB response, it was excellent because we already had those relationships established and we're able to coordinate with them up to the director, and we get really attention up to the director when we need something. And it's been a great relationship. Working with the tribal, Hualapai, that's a current, ongoing process that I have that I've developed and coordinate with them. Then again, my opioid activity, senior centers activity, medical examiner, my board of health activities, my board of supervisors, liaison, and then just in my department, presentations and continuing ed and research. So on any of these things, you'll be able to look like, is it going up? Is it going down? And month to month, it's kind of harder to see, but just be able to also then full transparent, you can ask me on any of these questions, like what's been done or what is being done on these points. So really, that's just mine. I'm going to go ahead and pass the time to each of the division managers. They're going to give a precursory review. And then from that, this will just be a monthly activity report that the board will receive, and any recommendations on your part on how best to proceed, or if you would like more information or less information. I will say on these reports, eventually they may become white noise, but they will always be present. So when needed, then they're there. Sometimes, it's like, why are we doing this exercise if it's white noise? But it's transparency, it's openness, and I believe it's important. So for my activity, any questions?
Questions? Seeing and hearing none?
All right, I'll go ahead and turn it over to Melissa Palmer for administration.
Okay, so for administration, we start out with our vital records counts. Is this Dr. Kinsley, is this
It's a touch screen, yes.
but there's.
Oh, that thing.
Oh, okay, so you just weren't forwarding. Okay, this is great. So you all can see then our counts, because I'm not going to go through line by line and name off each of these numbers. I do want to point out, though, for vital records, this is how many were printed. So for birth and death certificates, it's the numbers that were printed, not necessarily this is how many births and this is how many deaths occurred. Some of our death certificate requests involve multiple copies because of insurance purposes, private record purposes, lawyer purposes, that type of thing. Communicable disease report comes next, and that's going to be dove into much more detail in a little bit. So I will move on to child fatality review. We're pleased that our child fatality review cases that we need to review dropped from 23 last year to 16 this year. And these counts include La Paz County. La Paz County is a small health department, and so we have provided review of their cases for them. Next would be suicide mortality review, which we already included this. The case counts for last year was 33. This year was 108. And I know I said 107 during our presentation. There was one case that was identified through the overdose fatality review that was then provided over to us. So it wasn't a part of our original case count that we got from ADHS. Next is our accreditation and public health improvement. And it looks like we did nothing in September. The thing with any of our community partnerships or accreditation activities is sometimes we're in a holding pattern for certain things to occur. So, for example, our accreditation domain meetings have been on hold because we're awaiting FAB to come and do the reaccreditation site visit for us. And we're told we're in the queue. We don't have a date yet. So until we get that site visit completed, we're holding off on any activity towards our next 5 years of accreditation. Our quality improvement projects were 0 because we closed out 2 of them last month or in the month of August. And we just didn't have the time to start up any new projects. And then our community health needs assessment, the pre-meetings are in process. We are partnering with Kingman Regional Medical Center again in order to do the community health needs assessment, and we're running on their timeline because they are heading it up, therefore paying most of the bill on that. So we're on their timeline. And then social media outreach. You'll notice September 2022 that there's a lot of NAs. We were not tracking this information back in September of 2022. You can see we have a total under fiscal year 23. That total was for the entire year, and then we have our year to date so that you can see somewhat of a comparison since we weren't tracking it in September. September, as I stated during my suicide mortality review presentation, it was mental health awareness and suicide prevention. We did not have a lot of interaction, but it wasn't a happy, go lucky type of outreach and items that were being posted on our social media. It was more to get that information for those numbers, those crisis numbers out there. And then our public health emergency preparedness. There were some exercises, drills, a lot of meetings with tribal and healthcare and EMS partners. You'll see that that's an increase from last September. Our team has been very successful in engaging with our tribal partners, and therefore the meetings have increased. For finance, our number of contracts went up. We did end up with a workforce grant that increased from 19 to 21. Cost expenditure reimbursement submitted, so that's the billing that we submit to Arizona Department of Health Services in order to get paid for our efforts. That decreased in September. Some of our, we call them CERs for short. Some of them are quarterly, some of them are once a year. So that number automatically fluctuates. It's not a reflection on if we're doing more or less billing, it's just the timing of the billing for that one. Under behavioral health, you'll notice that they've been busy. They are preparing for the November 9th Mental Health Symposium that will be at 10 a.m. at the Kingman Library. And then under human resources, that first item, terminations, it sounds somewhat aggressive. That's what we call anybody no longer working for Mojave County. So it's a separation of employment is what it is. So it's whether they were terminated or they resigned. And we saw somewhat of a decrease from last September for that. Our hires, 2 as opposed to 3 for September of last year. Our vacancies are down. That's a positive, although that number is constantly fluctuating. Also, we could see a change in that from week to week and sometimes day to day. And that's it for me. Any questions?
No questions, but I'm happy to see there's no retirements.
Yes, although we have a few in the background that we're just hoping hang on for a little bit longer. Thank you.
Next is Tara Stanek.
Thank you very much.
Yeah.
Okay, now we have Environmental Health Division. Hello, Tara.
Good morning, board members. Let's see, I don't have much to share outside of what is on the report. The report contains mostly our inspection activities on our food safety and sanitation program, and our food safety part of that is all the food establishments, brick and mortar, the mobile units, and things of that nature. How do I press that forward? There we go. Our sanitation aspect is like hotels, the lodging facilities, campgrounds, RV parks, recreational health operations such as swimming pools, garbage trucks, pumpers and haulers, pet shops and groomers. And then we move into our nuisance program, which is really just complaint investigations when there's a public health nuisance. So green pools that might breed mosquitoes, unkempt yards with animal feces, things of that nature. And then our vector program, which of course is our mosquito surveillance. And on, let's see, am I going backward on this? I am, aren't I? going the wrong way on the slides. So there's two components to the Vector program. One is the fiscal year to date, and then on page 4 is also the season to date, because the mosquitoes do not follow a fiscal year like we do. So it's a little more accurate and reflective if you look at those. And one thing I really want to point out is over twice as many mosquitoes have been trapped this season because it was so wet this spring, and it was such a hot summer. But the complaints that have come in are relatively the same, and I haven't had any come in from any of the supervisor's office. So that's a big commendation to our special programs coordinator in that area.
I'm going to say you're doing an excellent job in District 4 because I haven't seen a mosquito in decades.
Yes, oh, very good, very glad to hear. And then the last of these programs that we report on is our Smoke-Free Arizona program, which of course is the prohibition against smoking in public places and things like that. And part of that program occurs as a result of our regular inspections of permitted establishment. And then the other aspect of that program is for the establishments that don't need to be permitted by the health department. So those are also, we just go out to the business owners, make sure that they're in compliance, give them new stickers and educational material for their establishments. And that is really all outside of, I don't have a report on our human capital here, but we do have 3 vacancies of inspector positions out of 8 inspector positions. So that's really quite significant. But so far we've been able to stay on track as far as all of our business operations and inspections, and are even above what was being done this time last year. There were a lot of past due inspections, and that's been corrected. And so we continue to stay on track with that despite being so short-staffed. So are there any questions?
Yes, I just this curiosity here is you have surveillance mosquitoes collected over 400,000, and I'm wondering how that takes place.
Yes, so our special programs coordinator goes out and sets traps, and they're CO2 traps. So they put dry ice in a bucket and then hang a net, and the mosquitoes are drawn to that CO2. That's why they come to us humans, because they sense our breath, our CO2, and so they're drawn to us. And so they're just big nets, like enclosed nets, and they come in, and then they're taken back to the lab. They're counted. I think she counts like 3 or 4 batches before she's, I think about 100 it is, and then she starts weighing them to get the count.
Yeah.
So it's really quite the process.
Anecdotal, but interesting to me.
Yes,
So,
yes.
thank you.
Anything else for me?
How does one get that job, counting mosquitoes? I mean, that has to be tedious.
It's really fascinating.
Not only do you have to individually pull, you have to also identify their species. So not only are you pulling them apart, you also look at the coloring, because they have stripes on them or different types of coloring.
There's a microscope involved?
She does. She sits there with a microscope. Tweezers. Yes.
Whoever does that job, thank you so much.
I believe she presented back in March, so.
Yes, Shelley, yes.
All right, if nothing else.
No other questions, so thank you very much. Next will be Lynn Valentine with Nursing Services.
Okay, so let's see if I can get this to, oh, there we go. Okay, so I won't go through each section either. Just what I did try to incorporate is some qualitative data, just try to include some of the activities and events that we have participated with each program or other notable activities. So it starts with general nursing services, which includes our adult immunizations and our communicable disease program, but the communicable disease program, which is where we do investigations of communicable diseases, that is captured in our epidemiologist's report, Anna's report. So I we'll defer to that report to give some numbers on the different communicable diseases that we've been working on. I will be talking about, as far as general nursing services, I will be discussing the Bridge Access Program here shortly. So I'll give you more information about that in just a bit. Obviously, our TB program, we saw an increase in TB skin tests administered and latent TB cases, and that's largely in part to the active TB case in the Bullhead City area. Family planning, unfortunately, our wonderful nurse practitioner who was our provider for that program has resigned. She's moved on to another venture. And so we do have a vacancy for the provider position, and we can't offer those services until we get another provider. And it's really anybody's guess when we will find somebody to hire. So I'll put the word out there. If there's any nurse practitioner who's interested, give me a call. Childhood immunizations, at first glance, it looks like bad. That's bad that our numbers are down, but that could be a good thing because that means that perhaps they're going to providers to get the immunizations and they don't have to come to us. So that's what we're hoping. We won't know that until the immunization data comes out later in the year, but that's nothing that we're concerned with at this time. Our HIV prevention program, our numbers were up as far as our tests conducted out in the community and during our family planning clinics. Our HIV prevention program staff member also just resigned. He just left us a couple weeks ago, so we are actively recruiting for that position. And then the bottom two programs on that page are our home visiting programs and the high-risk perinatal program, which is when our nurses go and visit families who have come home with NICU babies. Those numbers they're a little down, but they're not too off. So it's nothing that just kind of depends on how many families we have enrolled at the time. Health Start program is up. We are fully staffed in that program. That's when we have community health education specialists visit families with young children and provide education and support to those young families. Then on number 8? Number 8, we have our occupational employee health program, which is just focused on Mojave County employees. And we track those numbers as far as compliance, how many of those positions that have OSHA mandated vaccinations, how many are in compliance with those OSHA mandates. And they stay relatively high, so there's not much variance there. Our coordinator does a great job of tracking those and making sure that those employees who are eligible for those vaccines and TB skin tests are getting them or declining them if they so choose. And then the mobile health unit program, we weren't tracking back in 2022, September of 2022, because we didn't have it up and running, and we didn't have it, period. So we don't have really anything to compare to as far as back then. But don't let that number fool you with September showing 0 client visits or screenings provided. We have been out in the communities. That month we had our NP who had gone to a national conference, and we had some other events that we were attending, but it was mostly community-based meetings and promoting and making connections with those communities. I will be talking a little more about the mobile health unit program here shortly as well. And then lastly, our STD program, I don't have any numbers at this point because that is relatively, it's not a new program, but we do have a person now who is full-time dedicated to that program, who is a communicable disease investigator for STDs. And she just started a couple months ago, and so we're still working on collecting that data. But we will have data to share as far as how many cases she's investigated, any other notable activities with that program. And that is nursing in a nutshell. Any questions?
Any questions? Okay, thank you very much. I will go on now to Nutrition and Health Promotion Division with Brenda LeBlue.
Good morning, members of the board and the public. I'm Brenda LeBeau. I'm the manager of the Nutrition and Health Promotion Division with Mojave County. And let's see. Okay, hopefully everybody can see that. So basically my division is involved with, as it says, nutrition and health promotion. We have a lot of our activities surround nutrition, providing nutritious foods, providing education for our community, as well as activities with health promotions such as physical activity, nutrition education, gardening activities, meals for seniors, other things like smoking cessation, prescription drug overdose prevention programs, things of that nature. So our first program, Arizona Health Zone, you can see between last year and this year, we did have significant increases in the community which we served. The Arizona Health Zone program has been involved with various programs such as nutrition education, gardening, and physical activity. They have extended their reach to rural communities such as Colorado City, Topak, which they had already been serving, but Topak, and then now Peach Springs. So, so there's been several increases, and also after COVID, we were able to go out into the community a little bit more with that program. Our Health in Arizona Policy Initiatives program, you can see between last year and this year, there's been a decrease in our program numbers, but we did have a late approval of their action plan. And so our coordinator who is responsible for that program has, now that the action plan has been approved, has jump-started into various activities such as chronic disease prevention management, as well as Tai Chi and blood pressure monitoring are some of the highlights of that program. So if you see any information on that, that is one person who is involved with that, and the program numbers we expect to increase over the course of the year. Our Mojave Tobacco Use Prevention Program, obviously you've seen increases in that program. They did have an increase in staff from 2 to 4 members this year. So as time goes on, you should continue to see increases with that program as well. Oop, I forgot to advance the slide. Our Overdose Data to Action Program, we've had increases in collaborations with schools and other programs post-pandemic. So as well as the rural areas with all of our programs, but we would like to see further increases with program outcomes, but our funding sources, our funding streams are changing with this program. We did become the hub of naloxone distribution this year. So we have been recognized as a distributor and educator of for naloxone. But our staff has decreased. It says our staff has increased from 3 to 4 staff, but now our staff have decreased from 4 to 3 since writing this. So, but as time goes on, and hopefully with opioid funding streams from the lawsuits, that those numbers hopefully will continue to increase and change as time goes on. Our Women, Infant, and Children Supplemental Food Program, our WIC program, you can see our September numbers have not come in yet. By the end of October, we do have our September numbers available just because of food packages, late food packages being issued. And our program actually has been increasing. We did get an increase in funding in that program, and now we are fully staffed, but we are currently in the midst of training for that program. So that program, hopefully we can sustain the increase in numbers here with being fully staffed. Our breastfeeding peer counseling program, you can see that our numbers have decreased, although our numbers really haven't decreased. It's just kind of the way that our documentation has has translated over. We are streamlining our documentation. We used to document just for flyers and things that we sent through email and text, and we have not been documenting because of that, to kind of give a more accurate reflection of our numbers. We still have quite a few. We have quite a few breastfeeding peer counseling participants that we do see, and our breastfeeding peer counseling staff is at 0.3 FTE. So she makes an average of 44 contacts per week for our breastfeeding peer counseling program. So that's quite a few contacts for her position. And as you can see I wanted to reflect our program numbers, and they come out every year in July. So for our 2022 numbers, even though as far as how we document our contacts, you still see an increase for the majority of breastfeeding data that has been gathered, except for the 18 months breastfed infants. Then our senior nutrition program. So our congregate meals are still experiencing some fluctuations with our program numbers, but as you can see, our home delivered meal numbers have increased significantly. So we have had, with our senior nutrition programs, we've had several costs that have affected us with utilities, food, and then decreasing funds available. They haven't changed much from WACOG except for the COVID ARPA funding, which is going to be going away this year. And so we are looking for other sources of funding for that particular program, as well as Dr. Kingsley, I think, is still presenting on this later on for senior programs. And so he might be able to give you a little more data on that when he presents. So I'm not gonna rain on his parade here.
Okay,
So
thank you very much.
Thank you. Is there any questions?
I don't see any. Thank you very much.
Thank you so much.
So we took a little bit more time just to go through this, so in the future, we'll just be able to, if there's any questions to it, we won't go through it as extensively, but this will be available to you each month. We'll send them out, and then any reviewing questions you have on those, and then as well as for the community, it's accessible to that. But any recommendations for us on this, or any other information you'd like to see in it with this? Or is this something that do you feel is a good move, a direction for the department to provide for our community?
I think the way it's presented is very nice. It's thorough, and it gives us a reference of how involved the health department is and has been. So I appreciate it.
Is this shared with the Board of Supervisors?
Yeah, so can go two-way. I can just go ahead and share it each month if you guys would like me to do that, or if you as board members who's been appointed by your supervisor would like to share it, there's that route too. So it's whatever way you want me to do it.
I think it's valuable.
I'll share it with my supervisor.
But I would just do it with all the supervisors.
Okay,
I think it's that important. Do we need to vote on that, or?
No, just the direction's good enough. No.
Don't you think, Jim? Wouldn't all the supervisors appreciate this information?
I think information is very powerful, so
Yeah.
it certainly wouldn't hurt.
Yeah.
Oh.
Yep. And I just appreciate the transparency of it too, so.
Sure.
Thank you.
Okay, so we'll move on now to other business to come before the board, and we'll start out with Anna with the communicable disease report. Are you Anna?
I am Anna today.
Thank you.
Yep.
So cute.
Thank you. My wife would agree.
I'll put that in the minutes.
So just go ahead and a quick review on this. You believe they might be pulling it up on the screen. But just go ahead. Oh, there we go. Oh, I guess we can do it. There we go. Okay. So just reviewing over this is the regular report that we go through. Not really much to change on or anything of concern when looking at the information. regular process. We're not seeing a spike in any of the diseases that are reported to us or through the state. Anna does an excellent job as in constant communication, and just our process is always of working with our healthcare providers to make sure that these are being reported correctly and that we're able to report on them. As you can see, there is that increase in RSV that continues to be one of the respiratory, as well as flu is maintaining now that following forward, I think they had a better tracking method of it, but with that came the tracking of RSV. So historically, this number may have been there, but not as readily tracked in the past or easily. Now they have much more diagnostic tools that are simple, being able to diagnose that. So then overall, these are just the numbers. Any questions on these or any trends that you have concern or would like us to further look into?
Doctor, say I was looking down this list earlier, and the COVID thing, there's no numbers on that, and then the hepatitis C, there are no numbers on that, and I was curious as to why that is.
So looking at, down at the COVID numbers, looking at 2002, and then the numbers went down, and then your hepatitis C, correct?
Yeah. Yes.
And I had looked at that. I just want to review it real quick again. I'm only seeing A and B. Where's my C at? With COVID, to explain the difference of the number and up and down. So with COVID, and this is a national trend, is that the only type that we're really going to be able to track how COVID is affecting a community is by hospital admissions. So with the introduction of at-home kits, people take them, they tell if they're positive or negative, nothing is reported for that. So with COVID-19, so it's that basis there. So any of these new variants that we hear of or are affecting within the community, if they say they have a spike, it's really coming from the hospital administration, where in 2022, we still had numbers that were reported differently. With testing sites, there was a little bit lag over from there. So it's really the data there is just not looking at individual cases. It was the testing methods that were going on. And so that's the difference explaining there too of the COVID-19. What it actually is in our community, which, many have their opinions on it, but really those numbers are being reflected by what is being admitted to a hospital or where it's detected at in a hospital. For hepatitis C,
C on the list.
so hepatitis C isn't reflected on here. I don't believe it is one of the reportable diseases, if I remember right. There's a few that you'd think that were reported, but they're not. Hepatitis A and B tend to be more community outbreaks and are followed. But usually HIV, I'm not as familiar with this at times. I can go through and explain the pathology of all these. I'd have to follow up. I'll have Anna follow up on hepatitis C and just give an update on it. Where's it at, and what's the presentation, and what's really the reporting criteria for hepatitis C. So I can bring that back.
Okay, very good. But so if COVID is dependent on the number of hospital visits, then is influenza the same criteria used to get the numbers?
Yes and no. So most of that, yes. And that's always been the issue with influenza and RSV is that, again, many times people have them in the community, but they're not reported. But doctor offices now have, before in the past, doctors, when somebody would come to a healthcare provider and they would have a respiratory disease like that, many times just through signs and symptoms, a doctor say, well, most likely you have this by your presentation. With influenza, it was hydration and rest, and then if needed, Tamiflu, depending on the progression. If it was bacterial, if they could identify it, they usually could see from sputum and different, but it was kind of an educated guess based on symptoms. Okay. The testing for influenza, and Dr. Nguyen perhaps could speak on this, but testing for the RSV now is much, there's diagnostic tests in healthcare providers and doctors' offices. So we are experiencing that due to technology, having an easier way to identify influenza. So that is influencing numbers and case numbers. Correct, Dr. Nguyen?
Correct. There's more and more testing available, especially with a PCR, which is very rapid. So we might see an increased number over the next few years in terms of detection.
Yeah. Historically, on the numbers of flu cases was really an algorithm that was an educated guess on a lot of points and really what was going on in all our communities based off such and such. But what's a good thing is because of those rapid testing that's able to be done and is there just in the room sometimes will begin to give us a better accurate picture. And influenza and RSV are just lumped together. So when they test for one, sometimes they just get the other one as well. So.
Very good, thank you.
That's it, if there's no more questions.
I think that would be all. Thank you very much. So we'll go on now to Scott Wright telling us about the Medical Reserve Corps. I understand this is a grant that we're applying for and bringing this back. It's something we've had in the past.
No, it's a brand new grant. Basically, the way it all started out is the federal government, ASPR, put out requests, put out the grant probably earlier in the year, and they were only going to give out X amount of dollars, or actually it's $2 million they were putting out to individual groups, and they were going to give out so many grants. There wasn't going to be very, very many. So what happened was the state of Arizona said, hey, we're going to apply for this grant. How would you use the money if it came to you? So what we did is, I think it was in March or April, we just said, hey, if we got this grant, we would put together we would get a part-time MRC volunteer coordinator. We would basically beef up our Medical Reserve Corps and expand the planning, the training, and make them more prepared to respond to incidences. Just to kind of give you a little background, what MRC Strong stands for, it's because it's kind of spelled kind of wrong or weird, I guess. Medical Reserve Corps, state, territory, tribal nations, representative organizations for next generations. That's what the MRC Strong stands for. And it's a 2-year grant. It actually started in the beginning of this fiscal year. The state received the grant. It was for $2 million, and it's going to be appropriated through different organizations throughout Arizona, through the counties as well as the tribes. And our portion of it would be $126,500. And what that would pay for would be basically, it would pay for a person to be a coordinator for it. We're looking probably at a part-time person for that, but it would pay for up to a full-time person. And it would also pay for training, travel, and some equipment that we may need. The purpose of the grant is to expand, sustain, and to improve our MRC program. Just really quick, during COVID, our MRC was very robust. We had a big push to get people to become part of our organization. And I guess really quick, there was like at least 100 people that were part of that program. And that was when we were doing COVID testing. If we wouldn't have had the MRC program at the time, we probably would not have been able to do the large COVID drive-throughs and putting shots in people's arms. So without that program at the time, we would not have been able to do that, I don't think, at least not very effectively. Since then, it's dwindled down, and the reason for that, burnout. We asked a lot of those people, and they get nothing in return for being a volunteer. They don't get any pay. They don't get compensation for travel. They don't get, we try to provide lunches when we can, things of that nature, but there's really no compensation. So it's total 100% volunteer, and satisfaction is what they get out of when they volunteer for that program. So there's burnout, and then since COVID, there's been the engagement portion of it. What are we going to do to keep them active? Because once again, if you're going to be part of an organization, you have to keep them active. And we were not able to keep them active in the community. So we're working on that. So how would we use the grant if this was approved? Basically, it would to be statewide. We're going to be creating a MRC coalition, a statewide MRC coalition, and that's to bring all the coalition or all the MRC teams together so we can kind of coordinate response efforts within the state. In addition to that, it's going to be able to build our local coalition. Some of the things that we're going to be doing with this is the gap analysis. How can we best use the funds and to meet the needs of Mohave County? So there'll be some type of gap analysis process that we're going to be doing, and we're going to be working with the state and other MRCs within the state as well. We're also going to be supporting medical partners, healthcare workforce, improve access to care, grow our networks, and ready response teams. What are those? One of the things that we had during COVID was the lack of personnel within hospitals. So we were trying to scrounge and get people, qualified people to maybe go and be part of the hospital organization. So what we did with that is we worked through, we had strike teams basically that were created by the National Guards, and they would come in there and they would supplement the hospitals within the county, actually throughout the state. But the very, very limited resources, both on the state level, on the federal level. So one of the things that this grant would provide through this coalition would be to create strike teams, as what they're calling them. And these strike teams would be made up of members from our Medical Reserve Corps. And so when there was a need for a specific incident, these strike teams could go and supplement the healthcare facility that may need that assistance. That's one of the things that they're trying to do with this money. Like I said, it's what we would be getting out of it with the money is the volunteer coordinator, travel, equipment, and supplies.
So this MRC is a team of volunteers who stand at the ready in case we have some kind of a medical emergency or disaster, similar to COVID or to the TB scare that we had down in the Bullhead City area.
Exactly. We actually had members of the MRC at that response.
So the rest of the time, they're just on standby waiting to be called?
Not necessarily. That's one of the things is that when I was talking about engagement. So we started a program, we're getting some of them to be certified and teaching CPR, so to go out into the community and teach people how to, CPR. That's one of the things that we're trying to do. Another thing that we're trying to do is, I don't know if you've ever heard of the Stop the Bleed program. It's basically using a tourniquet to stop the bleed during an emergency, and that could be from a car accident. The more people that are trained in it, the better you are. So it could be an active situation, active shooter situation, where somebody comes in and there's going to be lots of bleeding. People who are trained in that, they're going to be able to stop the bleeding. But not only for that type of thing, it might be for just any type of accident occurs. So a traffic accident, you might come across, lots of metal flying around, lots of cuts and gashes. If people are trained and stop the bleed, they're able to stop the flow of blood and, potentially save people's lives. So those are some of the programs that we are in the process of training our MRC members to do. Like I said, we've shrunk down from 100 to roughly right around 35, and active members, we're talking about 4 or 5. So what we want to do is boost that up so we have, 50 to 100 people that are part of that are active and that we engage the community. And the Medical Reserve Corps doesn't mean just medical folks. They're a big portion of it, but there are also a lot of lay people that are not have anything to do with medical. They have no medical background whatsoever. So we might have a chaplain in there that might help out with some of this stuff. You have people that might help set up a clinic, bringing in all the support materials for that clinic. Just people checking in the patients that are coming into that clinic. So you have all kinds of people that are going to be a part of this program, and just not necessarily medical folks. So it is a response team, and they do come out during emergencies, but they also go out there to the communities and provide a service from there. That's where that gap analysis, I can sit here and say, this is what we need, but I think everyone here knows that, what we may think is the need is not the need that the public actually perceives. So we have to go out there and do that analysis to figure out what is the best way to serve the population of Mojave County. So,
Madam, I would also add in, so having an MRC is so that any community or county, like the health department or its risk department, can be bigger than it is in responding. So say we have a tourist bus that turns over on its way to the Skywalk, and there's 60 individuals, and we have to set up a joint information center, as well as a care, or if there are deaths, or if there's a mass shooting, same thing. We set up a joint information. We also set up a family resource center. And so this allows us to have these individuals, and these are many community individuals that want to participate, like, how can I help? What can I do? Many people feel defenseless. This allows us to do it correctly. So yes, we will, in any incidents, I think, you will have community members that will step in and say, I want to help. How do I help? This allows us to make sure, one, they're trained, two, that they're vetted. We're just, we're not putting the wrong person that perhaps shouldn't be access to children, to adults, or any of those situations. This allows us to do that, to make sure that we have that. And then we have that course. So this is our version of a National Guard for our community when we need them. And they stand ready for that, so.
and to follow up on that, this all came about, Medical Reserve Corps came about through 9/11. So what happened was you had all kinds of people going to New York City, to help out. We didn't know who those people were. So what President Bush did was created the Medical Reserve Corps. So you have people like Dr. Kingsley was saying are trained. They've already been vetted. Because like I say, you want to know who's going to be out there helping people, because there's some people with nefarious ideas, and they'll come to these types of situations, and they'll victimize people. So we want to have people that we know who are there. It's a force multiplier. To go on the fact that a perfect example for Mojave County, the American Red Cross, great organization, but there's only one or two people in Mojave County that are Medical Red Cross folks. And that fluctuates. So what happens in a mass disaster when we need to have a shelter? What we call American Red Cross is our sheltering folks. So we have to get people in from Phoenix or possibly Prescott or Las Vegas to come and, to do that process. But if we need to get something up in a hurry, if we have our Medical Reserve Corps, one of the training things that we would like to implement is the fact that they're cross-trained in the American Red Cross sheltering system. So what we can do is we can call our resources together, set that up, the shelter up, and then when American Red Cross folks show up, it's turnkey operation. They can come, take over the operation, then we can step back. So that's one of the big needs that I can tell you right now that we have within the community, is being able to do that.
Okay, wasn't that what Paul Pitts was involved in?
Yeah, Paul Pitts was the coordinator, probably up until about 3-4 years ago, yes.
Okay. All right, well, what's the pleasure of the board?
I got a question. This is Terry from District 2.
Yeah, go ahead, Terry.
Mr. Wright, as I was trying to read through this last night, it looked like 2 of the zones are federally funded. Is that correct?
This is all federally funded. What happens is that comes from the federal government, goes to ADHS, the state, and then the state pushes that money out to each individual MRC group, or to the counties, or to the tribes.
Okay, forgive me, I probably asked the wrong way. It seems like here there's already been 2 established and running MRCs in this state. Is that correct?
There's more than 2. Like I said, we do have one here in Mojave County. It's just that it's kind of waned down to what it was during COVID. And the 2 that you're speaking of is in Pima County and Maricopa County. They have very robust MRC teams there. And then it was basically, as a result, Pima County is a nonprofit organization, so they have a full-time person that's actually running that group. And then Maricopa County is just, I think, the size and the amount of people in that, they're able to bringing lots of folks in there. So they have a very well-established organization. So what they're going to be doing, they have two different, they call it,
Tier 1?
yeah, Tier 1 and Tier 2 groups. So the Tier 1 groups are going to be like Mojave County and the smaller counties within the state. What they're going to be doing there is if they don't have an MRC already, they're going to build their MRC. If they have one, but it's lacking, it's going to build that existing unit up to a more capable unit in the future. The Tier 2 basically are going to be our support agencies, so they're going to help with training, logistics. They're getting extra supplies that they're going to have on hand that if we need them in an emergency, we can go to those resources and get those resources from them. So that's kind of way. Does that answer your question, sir?
Well, ultimately, I think my question is, in terms of this is a 2-year plan that we're looking over now, where's the funding going to come year 3, year 4, et cetera?
Okay, from there, there's going to be, there is sustainability as part of that. So that's going to be something that we're going to be working through as this goes through. How do we sustain this in the future? In the past, in our FEP program, we have two people in it, the coordinator and the planner. And in the past, the planner has been basically the coordinator, or I'm sorry, the volunteer coordinator for the program. So without additional funding, what we would probably be doing is our planner would once we have a program that's manageable and we're able to have everything in place, that person should be able to run the program from that position. That would be without additional resources. As well as my vision at this point in time, like I said, it may change after the gap analysis, but my vision is to have volunteers that are actually running the program at their level. So there would be a volunteer coordinator in Kingman, a volunteer coordinator in Bullhead City, and a volunteer coordinator in Lake Havasu City. And eventually, hopefully, up on the Arizona Strip, we believe that there's a need up in the Arizona Strip to have a coordinator up there. But those will be non-funded positions. Those folks will be basically, they know their community, they know their needs. They would be running the meetings. They would be looking for what resources that they need, the training that they need, things of that nature. So it would be run, a lot of it would be run by the volunteers. The paid person, which would be the planner, would basically be working with those community leaders in the program to basically support them whatever they need, if that makes sense.
Okay, thank you. That's what I was wanting to know. Thank you.
You bet.
Just to point out, this is interesting. It's always so these grants come too, and it's $2 million, and no rural community of the 13 counties that we have in Arizona would be able to apply to get that $2 million. We just didn't have the size, something. They're like, well, we're going to put the money where it's going to be most useful. So as is normal, Maricopa or Pima would be the one that would be able to get it. But through that, the rest of us the county director said, that's not fair, but how could we do this? Because we have MRC programs, but they're struggling right now. We need to build them back up. So what do we do? So that's where our relationship, or my relationship with ADHS came in. We sat there, we discussed it, and we asked ADHS, and they said, yes, we will apply for it as a state, and then we can be able to distribute to the counties. And that's the reason we were able to get this, and then really distribute it to each of the counties as well. So this is the whole process of working towards this, but it's an opportunity for a grant or money for MRC that can make an impact in our community that we wouldn't have been able to do.
Okay, so it's an existing program. We're just trying to shore it up.
Yes.
And the money's available, and you want this board to support application.
I'll make a motion.
I make a motion to approve the evaluation of the MRC Strong Grant in the amount of $126,500 to rebuild and train the Mojave County Medical Reserve Corps.
Second, Litz.
Okay, we have a motion and second. Any further discussion? All those in favor say aye, please.
Aye.
Anyone opposed? Okay, the motion passes, and we'll send this on to the Board of Supervisors.
Thank you.
Thank you, Scott. Okay, next we have an evaluation of the new FY24 staffing initiative for opiate settlement monies to fund a special program analysis. Dr. Kinsley is at the
So
podium.
I included a job description. So this would be a non-general fund, non-impacted to general fund. We will have 18 years or more of the general funds or the opioid settlement money that we will receive, on average to $1 million a year or more. And so when we, as I explained earlier, the RFP, the request for proposal, as well as distributing the money, once we send the money out to those awardees, we would like to be able to follow up with them, to be able to at least have quarterly meetings, have them submit data, progression, as well as the RFP process for when those individuals when we need to communicate with the community to build relationships there, manage the data, as well as have that point person that analyzes, so that if the Board of Super asks, where did the money go? How is it being used? And how is it affecting our community? We have an individual who is dedicated towards making sure that money, be able to report on it, how it is being able to done. If not, it's just, it falls, currently right now in the past, it's fallen primarily on me. And so moving forward, just be able to fund that position. So this would be a funding using the opioid monies so that public health can properly administer money for Mojave County and the Board of Supervisors. And so just seeking any recommendation or seeking a motion, if you support this, for me to ask the Board of Supervisors to use the opioid monies for this.
As a retired grant maker, I don't know how you can do this job and your job too. So
I absolutely would like to make a motion that this go before the Board of Supervisors. You want me to read it as it's written?
Sure.
A motion to evaluate for recommendation to the Board of Supervisors to fund a health systems analyst, non-exempt range 17, to manage Mojave County's opioid settlement monies in accordance with the One Arizona Agreement terms.
Okay, we have a
Boyle,
motion on the
second.
floor. Is there a second?
Boyle,
Second, Litz.
And any further discussion? Hearing none, all those in favor say aye.
I,
Aye.
Any opposed? Okay, motion passes. Thank you very much. Let me see, next on the agenda is discussion and possible action regarding the MCDPH participation in the CDC's Bridge Across program to increase access to COVID-19 vaccines for uninsured and underinsured Mojave County adults. Hello, Lynn.
Hi, I'm back.
What's this about?
So this is a program through the CDC called the Bridge Access Program. And what it is, the COVID-19 vaccine, which we know can be a topic of debate in some venues and with some individuals, the COVID-19 vaccine is no longer being offered to everyone free of charge. It is being covered by private insurances. Most of them cover the complete cost of it. But there is this part of the population who is uninsured, who would have to pay out of pocket to receive it. So the Bridge Access Program is additional funding that we can get through our immunization program that would allow us to offer the COVID-19 vaccine to uninsured and underinsured Mojave County residents. And we would like to, the primary goal of accepting it is to ensure Mojave County residents who choose to get the COVID-19 vaccine have access to it, just like those with health insurance have access to it. So originally, we were not sure how many providers in our area would be able to participate in the program because it's only for some pharmacies, for federally qualified health centers, and for health departments. And we have since learned that the local CVSs and Walgreens are also going to be participating in the program, so they will be able to offer the COVID-19 vaccine to uninsured and underinsured individuals free of charge. But we would also like to participate and be yet another layer of availability to those individuals to receive the vaccine.
Okay, so this is in addition to Walgreens and CVS offering this through their own means, through this program. It also allows the county health department to provide vaccines.
Correct. And we'll offer it obviously through our clinics, but also we would like to be able to take it on our mobile health unit and take it out to those rural areas and provide access to those individuals out there.
Where there are no CVS's and Walgreens, right?
Correct. Or they're very difficult to get to for some people out there.
And we're not going to be twisting arms or.
Absolutely not. Personal choice. We just want to increase access and support the freedom of choice for those people.
We realize
That
on this
amount
point
is-
too, that taking it to the Board of Supervisors and the public, there will be many individuals that may speak on this. Our point and what it is just, we are not educating on it. We are not, forcing anybody. This is just for an individual who does want it. It's, if you do not want it, then that is your healthcare and your choices. We are not obligating to do that. It's just to provide to somebody that does want it to be able to get it. And not everyone, as mentioned, has a CVS or a Walgreens right around the corner. We are a large community. We are a large county. We have rural areas. And for those individuals that do not have that health care, we would be able to provide it in those areas for anyone that asks. So it's just, on a point that I would say, if having explained to public, is just as much as we respect somebody's right to deny it, they should also equally respect an individual's choice to take it. And so I don't know how that will go. I know it is a divided topic among many of our citizens, but that is ethically, I think, the correct point, so.
I have a question, Lynn. What the number do you anticipate that we will provide? Because most of people are, if they decide to get the vaccine, they're already vaccinated. And for the booster, most of those have insured because those are the criteria are 65 and above, right? It's maybe a small percentage of immunocompromised, but so my question is, do you think we have a large number that we'll need?
Well, I can tell you that I did look up to see how many people we have uninsured in Mojave County. And Arizona's uninsured rate is at 10.3% of the population. Mojave County's rate is 14.2. So that's roughly, based on a population of about 220,000, that's roughly 31,000 individuals, over 31,000 individuals. And as of October 4th of this year, over 100,000 residents of Mojave County have received at least one COVID shot. So it's really anyone's guess, but we do have a higher percentage of uninsured individuals in our county as compared to both the state and national averages.
What is the cost of this kind of a program?
The Arizona Department of Health Services, they have allocated roughly $298,000 for us for what we need. We wrote a budget and we figure if we vaccinate or plan to use 5,000 doses, say, that it'll be about $268,000. Now this is from, they're considering the beginning of the program to be August 1st of 2023, and it will end in December of 2024, December 31st of 2024.
So it's state funded?
It's federally funded.
Federal?
Yes.
Federally funded.
Yes.
So I have a question. If a person has never had a COVID shot, do they have to have a beginning shot, an intermediate, or do they get the booster that's available now?
So they've actually revamped the COVID vaccine. Now it's a one and done. It'll be similar to how the seasonal flu vaccination is. So if nobody's had if a person hasn't had any COVID shots to this point, they can get this new dose and they are considered up to date, just one shot. There is one manufacturer where you do have to get two, but the more common ones, Moderna and Pfizer, it's one and done for the season.
Okay, has there been any discussion of offering perhaps the recommended, what is it, the RSV vaccine for people over 60? Is that something that the health department is considering offering as well?
Well, that can get a little complicated. We are now participating in the Vaccine for Adults program, which we hadn't done previously, where we can provide some vaccines to uninsured and underinsured adults. The RSV vaccine, I'm not quite sure what the status is through the VFA program at this point, if they have it available or not. So at this point, I don't want to say that we are offering it, but I don't want to say that we never will at this point.
With the RSV, it's recommended for 65 and above, and I think most of those people have insurance.
Not in my district. My district includes White Hills, Dolan Springs, Meadview, and Chloride, and
Then we really need to.
a high percentage are not insured.
One comment on the RSV vaccine, Supervisor Bishop, this is Hunter with Creek Valley Health Clinic up in Colorado City. We've looked into providing this, and it's very, very expensive if it doesn't come through the Vaccines for Adults or Vaccines for Children program. So right now, with just how new it is, we're looking at ways to provide that, but would end up losing a significant amount of money with providing that to the general public, especially those that do not have insurance. So there's still a lot of kind of loose ends on our end with even providing it. And
Can we use this funding for the COVID, for the RSV?
This is strictly for the COVID-19. Yep.
Any other questions or comments? Okay, what's the pleasure of the board?
I make a recommendation to recommend MCDPH's participation in CDC's Bridge Access Program to increase access of COVID-19 vaccine with choice for uninsured and underinsured Mojave County adults.
Okay, we have a motion.
Second, let's.
We have a second. All those in favor say aye.
Aye.
Any opposed? Okay, motion does pass. Thank you. Going on to nutrition and health promotion, we'll have a discussion.
I do believe there's just a quick discussion on just the update on mobile unit from Lynn.
And how could I skip that?
I know, right?
How's the mobile unit doing?
We are plugging along. We continue to recruit for a medical assistant. We did have a medical assistant. She was wonderful. We didn't get to keep her for too long because she had a change in plans. And so we are recruiting for a medical assistant. Until we get one, we are working with Kathleen, our NP, our nurse practitioner, and assisting her with the events and activities of the unit. Last month, our nurse practitioner, Kathleen, attended the Mobile Healthcare Association Conference in Pittsburgh and came back with a lot of great, useful information. One piece of useful information is that they emphasize that it takes a good 2 years for a mobile health unit to really get going. So, you know, just when we might start feeling like we're not going fast enough or we're not doing enough, it's typical. You know, it's going to take a good couple of years before we really get it up and moving. We continue to participate in community meetings and events, but we are making that transition to regular scheduled visits. And one thing that we will be doing, in fact, we will be doing it out in White Hills tomorrow, is partnering up with our Mojave County Library Bookmobile. They make regular visits to these rural areas, and so we thought that would be a great opportunity to go out at the same time as them because they'll draw in more people, and that will benefit us. We can draw people to hopefully the mobile unit as well.
Yeah.
We've been focusing at these community events where, just like we were just in Chloride this weekend, we really are focusing on the basic screenings like the blood pressure screenings. And I can tell you that these screenings have really highlighted the need for the services. In Dolan Springs, we participated in an event a couple weekends ago, and we did about 20 blood pressure screenings, and 3 of those individuals had very high blood pressure readings. They refuse medical treatment because that's the first thing we do is we suggest they seek, emergency. We say the ambulance is right over there. We can have you transported. Can't force them. But it definitely drove home the point of why we need these services. We have since followed up with those individuals, which is one service that we will also provide as follow-up. And we did link them to some care. And the 3 individuals have said that they have sought care or they have an appointment. So we will continue to follow up with those people to make sure that they are getting the care that they need. The unit itself, we've had a few mechanical and interior structural issues. Fortunately, most have been relatively minor, although it has had impact on some of our outreach activities. At this point, most of them are resolved. And I just want to take this opportunity to recognize our Mojave County Fleet Services and Mojave County facilities for being so helpful and responsive in helping us to resolve those issues, because they're really quick and very responsive with doing that. But at this point, we will just continue to keep you all updated, and we do provide updates of the unit's activities to the county manager, and I believe those are posted on a regular basis on the Mojave County webpage that discusses has an overview of the ARPA funded programs.
Okay, thank you. I have received quite a bit of positive feedback on the mobile health clinic. People are curious about it. They are seeing it. They're wondering what services are going to be provided. Yep. So the talk is out there and the people are ready. So
that's what we want. So that's great.
Okay. Thank you. Okay, so now we'll go on to the Senior Center Management Funding and Staffing for FY24 and 25.
Kind of important.
This just might be an update at this time to see on the time and just where we're at. We're in the evolution of really evaluating the senior centers and helping them to return to the correct type of productivity, funding, as well as, having a 501c3 go after funding to be able to help pay down any cost. The senior centers do impact the general fund. And right now with our budget concerns, so very focused on approaching ways that we can be able to reduce that. But it does take a process. And so moving, it's going to be a make them tell you no, or if you don't ask, you don't get an answer type of situation. I will be going to the board as a new initiative to restore. Previously, the senior centers were run as its division with a division manager. We currently have 1 full-time employee overseeing the 3, along with Brenda LeBou, who's the manager, that is managing anywhere from 40 to 100 volunteers at the Kingman or the Lake Havasu Center, as well as volunteers at Topak. We need to be able to write grants. We don't have anybody, to write grants, and just also the budgets, as well as Lake Havasu. They would like activities at nighttime, and we don't have staff to be there at nighttime, and so we have many challenges. And so a bare minimum, I would like to be able to ask for the employees to run it correctly. And then before then, and this year as well, I'm going to need to ask for perhaps 1 additional employee at the Kingman Center. The Kingman Center is also going to be undergoing remediation. It's going to be closed down while it's remediated and seeking additional funding, hopefully to increase its ability to be able to host events as well, weddings or receptions or those things at night times where we can be able to earn some revenue to help support the center, as well as have a goal within 10 years to be able to perhaps build a new center in its place here in Kingman. But long-term goals and short-term goals, but currently right now we are starting to experience critical loss at our senior centers. Here in Kingman, we have 1 part-time employee whose mother has Alzheimer's, was just submitted to a home, and she has 400 hours of PTO that she needs to use. But if she's not there, that means we have to close the center. So it's affecting our ability to administer meals. And Lake Havasu, we are stable relatively with being able to provide the congregate meals as well as the Meals on Wheels. But again, then if an employee has a doctor's appointment, we do have to close the center early. And so we are facing those challenges here. So I do need to go to the Board of Health and ask for those either additional funding for employees or for the future, or an alternate solution for those processes. So I just want to bring that to Board of Health as it deals with our budget, and you do oversee our budget on those points. I really don't know if we have a motion there, but just a recommendation or what direction you would recommend for me to take when knowing that information provided to you.
I make a motion to recommend that you evaluate for recommendation to the Board of Supervisors the management, funding, and staffing for the fiscal year 24 and 25.
Great. Okay.
I second.
Okay, we have a motion, a second. Any further discussion?
I just want to, this is Terry, District
Go ahead,
2,
Terry.
Coyle. Reading over this last night, oh man, this is a mess. We can't leave our seniors, I hate to say it, but like abandoned like this. We thrive on our seniors here in this community in Bullhead, considering that the average age here is 51. And I highly encourage that we try to do something to get more funding for this. This is very important.
Absolutely.
Yeah, and definitely a challenge, especially during a budget time. And a lot of what I've learned from Bullhead City, who had previously, when there were challenges following the economic crisis of 2009, 2010, and 2014, 13, 12, around there, that's when Bullhead City, the city took on the senior center there. And they've progressed to, there's been years that the 501(c)(3) has paid down all general fund from the city. Not every year, but they're very active in going after grants, and they are in the process now of building a new building there. So it can be successful, just need the correct tools and people to make it successful, Kingman and Lake Havasu and Topak. So that's my goal. So.
Chairman Bishop, I would like to just finish our motion earlier because we just have a second. Oh, thank you.
Okay, so we,
Just need a vote on the motion, I believe, correct?
correct, yeah, right. So we're still in discussion, so we'll get a vote here in a second. How much of this is coming out of the general fund?
Currently, right now, about $390,000 are coming from the general fund. It's one of our largest pools for public health. And unfortunately, too, and it was a point made that it will either come to a point that we will no longer be able to provide the services. It does not mean that the services will end, but if when we rank our mandated and essential services within public health, senior services are not mandated, or then they're on the bottom of essential. Now, I will argue that they should be mandated essential, but when it comes to ARS and where law's at on different things, they're at the bottom of the ladder, or they're at the bottom. So when faced with that, and that was presented to the board, if there is any type of budgetary cut that is needed in order to support the community and support the county in being fiscally minded during a deficit, this would be one of the first ones addressed, which is a challenge. The next is vital records with those points, but about $390,000 right now. So a difference I would like to point out is that Lake Havasu pulls about $100,000 from the general fund, but they spend probably over $200,000. The 501(c)(3) there pays for half the electricity, pays for half the bills. They have a senior day at the bingo parlor there, I believe, in town. And they can be more active too. We can also, they actually are going to begin to be able to rent that out at night. Somebody will pay for the security guard that will open and close it. And somebody can use that, and all those funds will go towards the operation of the senior center. Kingman experienced, unfortunately, we had to dissolve the 501(c)(3) back in 2017, 2018. Since not having that 501(c)(3), they're our largest pool. They have a higher number of Meals on Wheels, but we're pulling roughly, I believe, Topak is about 90,000, and then Kingman's pulling about 200,000. If we had a 501(c)(3), I do believe then Kingman could be good, could help impact the general fund with hopefully cutting it in half, but it would take me a year or so to be able to get to that point, hopefully. But I need a 501(c)(3), and we were just awarded through WACOG $20,000 in order to found, to pay for the 501(c)(3), and then it would just be getting it operational. So that, I think that's the difference it demonstrated of having a 501(c)(3) and not having it, that it will help pay down the general fund. We will still have general fund, but I believe even in better management, we could possibly pay down even more. But it takes staff, you know, it takes some dynamic individuals to really, to help manage all that. And staff is overburdened on that right now.
And then Bullhead City, are they a 501c?
They do. They have a 501(c)(3). Many might know Dr. Zier. His wife is the chair of it, very active in it, and she has done amazing work, but she puts in a lot of time. But that 501(c)(3) has really been the one that has also earned the money for the capital improvement to pay for that building. So.
Okay, well, it sounds like this program, at least in Kingman, might be in jeopardy without that 501c3. So
yeah,
hopefully we've got a year to figure it out before the board makes any drastic cuts to on mandated services. But we do have a motion on the floor. It has been seconded. Is there any further discussion? Okay, all those in favor say aye.
Aye.
Any opposed? Okay, the ayes have it.
Thank you.
Okay, and
All right, I
then
said
last is the agenda items for next meeting. Does anyone have anything they would like to have placed on the agenda for next Board of Health meeting? Seeing none, this meeting is adjourned.